1. Dandruff seborrheic dermatitis, safe flakes, itchy scalp. Kya hai? Scalp par flaky white yellow scales, kabhi kabhi lal oil khujli. Medical name, seborrheic dermatitis ya bolchal mein dandruff. Kya hota hai? Malassezia naam ka yeast, fungus, plus scalp ki oiliness, sebum, plus skin ka inflammatory response. Genetic or environment, thanda, stress, V-roll kati hai. Nishan, signs white yellow flakes, itch, oily patches, kabhi redness. Precautions prevention, step by step. Medicated anti-dandruff shampoo use karo. Ingredients, ketoconazole, zinc pyridinate, selenium sulfide, coal tar, salicylic acid. Shampoo ko scalp par 3-5 minute tak cholo fir bolo. हर रोज नहाना जरूरी नहीं, scalp oily हो to 2-3 दिन में 1 बार, otherwise tailored. Stress कम करो, सर्दीतन से बचाओ, dry air aggravates. Hair products जो heavy oils was रखत है, उनको scalp से हटाओ. Scratch न करो, infection ka risk. Home care, quick coal tar ketoconazole shampoo weekly rotation, scalp massage gentle, avoid very hot water. Kab doctor dikhna, agar severe redness, pus, bahut zyada shading ya OTC shampoos say 2-4 haftan mein relief na mile. 2. Dry scalp, khushk or flaky without oiliness. Kya hai? Scalp ka dry hona, flakes dry and powdery, dandruff se alag kyunki oil kam hota. Kya hota hai? Overwashing, harsh shampoos, cold weather, low humidity, hot water. कुछ लोगों का skin barrier weak भी होता. Precautions step by step care. Mild sulfate free shampoo use करो. Shampoo frequency घटू 2-3 दिन par. Conditioning सिर्फ lens par. Scalp को ज़्यादा condition ना करो. Weekly gentle oiling. Coconut jojoba, agar aapko suit kare, 5 test karo. Humidifier ghar mein use kar sakte ho winter mein. Kab doctor, agar soreness, cracks, bleeding, ya infection signs ho. 3. Oily scalp seborrhea, bahut tel ana. Kya hai? Scalp par excessive sebum greasy look, faster build-up, dandruff बढ़ सकता है. Kya hota hai? Hormonal, genetic, overstimulating scalp products, kuch diets. Precautions steps. Mild clarifying shampoo, zinc pyridinate selenium sulfide, 2-3 haftan mein adjust. Heavy oils products scalp pe na lagao, only length pe. Avoid daily conditioner on scalp. Balanced diet, stress control. 4. Androgenetic alopecia, male-female pattern hair loss. Kya hai? gradual pattern thinning, men, receding hairline crown, women, diffuse frontal thinning. Genetic plus androgen, DHT, mediated. Kya hota hai? Heredity plus DHT, dihydrotestosterone, shrinks hair follicles over time. Nishan, slow progression, miniaturized thin hairs, typical pattern. Precautions step by step. Early diagnosis, agar notice karo to dermatologist se consult. Early treatment better result de sakta hai. Avoid unnecessary chemical heat damage that worsens thinning. Medical options. Sirf dermatologist say discuss topical minoxidil, OTC, oral finasteride, men, low-level laser, PRP, hair transplant, surgical. Doctor say advice lena jaruri. 5. Thelogen effluvium, sudden diffuse shading. Kya hai? Acute, temporary hair shading, bahut sa hair follicles ek saath rest phase, thelogen, may chale jaake hai, fir 2-3 months baad shading hote hai. Kya hota hai? Major stressors, high fever, surgery, childbirth, severe stress, drastic weight loss, certain medications, illness. Nishan, shower comb kati walked zyada shading, hair becomes thin all over rather than patterns. Step-by-step precautions and care. Identify trigger, recent illness, surgery, medication, emotional stress. Nutrition check, blood tests for iron, thyroid, vitamin D etc. Doctors say. Gentle hair care, harsh treatments avoid. Usually 3-6 months may recovery hote hai, supportive care and patience. Cub doctor, agar shading severe ho ya 6 months se zyada rahe. 6. Alopecia areata, patchy autoimmune hair loss. Kya hai? Autoimmune condition jism immune system hair follicles attack karta hai round patchy hair loss. Kya hota hai? Exact trigger unknown. Autoimmune mechanism, kabhi stress associated. Nishan, sudden round bald patches, sometimes nail changes. Care steps. Dermatologist say confirm, topical intralesional steroids, topical immunotherapy, or systemic meds, severe cases may JAK inhibitors etc. Sub-doctor K supervision may. Emotional support and counseling jaruri ho sakta hai, impact high. Cub doctor, agar patchy loss ho ya spread ho. 7. Traction alopecia, tight hairstyle related. Kya hai? Repeated tension pulling, tight braids, ponytails, extensions, say hair loss, early stage reversible, chronic stage scarring permanent. Kya hota hai? Mechanical stress over time. Step-by-step prevention. Immediate change. Loose hairstyles. Alternate styles. Avoid tight extensions weaves. Use softer bands. No metal. If early hair regrowth possible, chronic scarring needs specialist. 8. Scalp psoriasis. Kya hai? Immune-mediated chronic skin disease, thick silvery scales, red patches on scalp, sometimes itchy or painful. Kya hota hai? Immune dysregulation, autoimmune pathways. Care steps. Topical steroids, coal tar shampoos, emollients, dermatologist direction. Avoid aggressive scraping, can cause bleeding. Treat flares promptly to prevent secondary infection. 9. Tinea capitis, scalp ringworm, fungal infection. Kya hai? Fungal infection of scalp hair, common in children, ring-shaped patches, broken hairs, sometimes pus forming. Kya hota hai? Dermatophyte fungi, Microsporum trichophyton, spreads by contact or fomites. Important: scalp ringworm usually needs oral antifungal medication, 1-3 months, topical alone not enough. Dr. Jaruri. Precautions: hygiene, avoid sharing hats, combs, treat family contacts. 10. Folliculitis, inflamed infected hair follicles. Kya hai? Small pustules, bumps around follicles, can be bacterial fungal. Kya hota hai? Shaving, occlusion, tight caps, bacteria, staph, hot tub, friction. Home care steps. Warm compresses to relieve and drain small lesions. Keep area clean. Avoid irritation. If spreading pus, doctor may give topical oral antibiotics or antifungals. 11. Contact dermatitis, allergic or irritant from hair products. Kya hai? Scalp rash from an ingredient, PPD in hair dye, fragrances, preservatives. Kya hota hai? Allergy or irritant reaction to product. Steps. Stop suspicious product. Patch testing possible via dermatologist. Use hypoallergenic, fragrance-free products. For severe reactions, topical steroids, antihistamines under doc. 12. Head lice, pediculosis capitis. Kya hai? Tiny parasites on scalp causing itch, common in kids. Treatment steps: CDC recommended medicated pediculicides, OTC pyrethrins or permethrin 1%, or prescription if resistant. Retreat per instructions if product doesn't kill eggs. Wash bedding brushes or isolate items. School policies updated. No need to immediately send home. 13. Hair breakage and split ends, trichoptilosis. Kya hai? Breakage in midshaft, split ends are irreversible, you must trim. Kya hota hai? Heat, chemical overprocessing, bleach perm relaxer, mechanical damage, rough brushing, dryness, poor nutrition. Step-by-step prevention and repair. Regular trims, 6-12 weeks for split ends. Limit heat, use heat protectant when needed. Use protein bond repair treatments, Olaplex K18 type products, occasionally. Gentle detangling, wide tooth comb, microfiber towel, avoid tight elastics. 14. Chemical overprocessing damage, burns, severe breakage. Kya hai? Repeated bleaching steroid relaxers overlapping chemical processes damage hair structure and follicles. Care steps. Stop chemical services until hair recovers. Deep conditioning, bond builders, protein treatments, professional salon help recommended. If scalp burned or raw, see dermatologist immediately. Nutrition and tests, small but important, stepwise. Agar unexplained shading ho rahi ho basic blood tests, CBC iron studies, TSH, thyroid, vitamin D, B12 and others as doctor suggests. Many hair problems linked to iron vitamin D deficiency. Balanced protein-rich diet. Avoid crash diets. Daily weekly scalp care routine. Simple step-by-step. Follow according to your scalp type. Determine scalp type. Dry, oily, normal. Shampoo. Medicated only if indicated. Leave on scalp 3-5 minutes for anti-dandruff actives. Massage gently with fingertips. 30-60 seconds. Don't scratch. Conditioner. Apply to lengths only. Avoid root scalp unless product says scalp safe. Limit heat. Blow dryer at medium. Use heat protectant. Weekly. 1 deep conditioning or bond repair mask if hair damaged. Protect. Sunscreen hat for scalp if much sun exposure. General AADNH's guidance supports these practices. Red flags. Turant dermatologist ke paas jao agar. Sudden, patchy hair loss, alopecia areata, or rapidly spreading loss. Scalp pus, severe pain, fever, possible severe infection. Raw burns from chemical service or scalp that's bleeding. Hair loss, 6 months without improvement or signs of scarring, follicles gone. Short summary, top 5 important facts, quick. Dandruff is equal to often malassezia plus oiliness, medicated shampoos help. Thelogen effluvium is equal to stress illness triggered shading usually regrows in 3-6 months. Androgenetic alopecia is equal to genetic plus DHT, early treatment better. Tinea capitis, ringworm, is equal to needs oral antifungals. See doctor. Traction alopecia is equal to avoid tight styles early to prevent permanent loss.